Thank you so much for joining today. And, especially for the cholesterol, I'll tell you, I have a very strong family history of heart disease and stroke. My father had a stroke. He's no more, and he had a stroke. And cholesterol is something that I'm always worried about. But even being a doctor, I hardly understand much about the cholesterol. It's so confusing every time to read about it, and then at what stage you have to take the medications. It's very, very complicated. And it is so linked with the cardiac diseases as well as obesity, as well as bariatric surgeries. Everywhere it is linked. So thank you so much for helping me to understand this topic today, and I'm sure people will be benefited. And I'll start with my first question. What exactly is cholesterol?
First of all, thank you, Dr. Smitha, for the invitation. I'm very glad to be part of this podcast. Cholesterol is basically a very important nutrient substance. It's very vital for life. Every cell in our body is lined by a cell membrane, and cholesterol is a very important integral part of that. Without cholesterol, the membrane will not work as it's supposed to be working, and there is an exchange of chemical molecules and chemical processes happening inside and outside the cell. So when cholesterol is not there in the cell membrane, this biological exchange of molecules will not happen as it is supposed to be. That's how it affects the overall functioning of the body. So cholesterol is basically a waxy substance found in each and every cell of the body, especially our brain, all our central nervous system, peripheral nervous system, so your brain, your nerves, they all are very rich in cholesterol because if cholesterol is not there, they are not going to function properly. So that's the very important vital role of cholesterol. Second, uh, cholesterol's vital role is there in production of sex hormones. It's a raw material for the production of sex hormones, like our estrogen, progesterone, testosterone, and our steroid hormone, which is very important for stress response. That is another important vital role of cholesterol. Third is vitamin D. Vitamin D is produced in our skin on exposure to UV light, and the raw material is again cholesterol. So if you're controlling your cholesterol, if your cholesterol is down, then you are going to be vitamin D deficient person. And this cholesterol medications will reduce your cholesterol, and it will reduce your vitamin D
Okay,
production.
so it is such a important, nutrient in our body. How do we manufacture it? Like, is it with the dietary sources, or do we have any de novo synthesis that responsible for manufacturing our own cholesterol in our own body?
It is such a vital molecule in the body that
Okay.
our body can take care of its cholesterol production entirely, even if you have zero cholesterol in your diet. Because the dietary component is only contributing to 20% of your daily requirement, which is up to 3000 milligrams or 3 grams per day. So, if you are not eating cholesterol, your body is going to manufacture every bit of cholesterol that is required by the body. 80% of this is manufactured in the body. Each and every cell has the capacity to manufacture its own cholesterol needs. Only one cell, that is mature brain cells, these are the ones which don't manufacture cholesterol, and that is why they are supposed to be getting their cholesterol from other sources, that is dietary sources, right? Or the ones which is there in the
And
blood.
then, if it is already there in our body, then why in few people cholesterol is increasing and it is responsible for cardiac condition, and why in few people it does not affect, it does not cause any kind of a harm?
So, in some people, it is high because of mainly the reason is dietary.
Mm-hmm.
And if you're eating a certain type of diet, which is basically high in simple carbs, especially the refined carbs, that is refined sugar, refined atta, these are the ones which actually increases your production of free fatty acids in your liver, which is known as de novo lipogenesis. Right? And to transport this outside the liver into the peripheral tissue, uh, The liver
Hmm.
produces what is known as VLDL, which is a lipoprotein,
Hmm.
which is part of your cholesterol profile. Right? VLDL will get rid of its fatty acids by giving it to various cells in the body that require it as a fuel or as a storage molecule, and the rest of the VLDL after supplying this fuel gets converted into LDL. So ultimately, your refined carbs leads to your increased cholesterol levels. Right? That is why vegetarian patients who are pure vegetarians who don't consume enough of ghee, butter, and cheese. Right? Why do these people still have high cholesterol? It's because the raw material that is required to manufacture cholesterol and fatty acids is extremely high in their diet, and especially the vegans. Vegans don't even consume any milk products. There is no fat or cholesterol consumption in those patients, but some of the vegans do have increased cholesterol
Okay.
levels. This is
But
one of the reasons for.
like you are saying that our sugar, refined sugar and atta, refined atta, these things are responsible. Whereas we look at the media and most of the promotion is about the oil, right? So which one is causing more harm? Is it just the refined sugar and this, or oil is, or both together?
If you tell me refined oil, there is no
Hmm.
clinical evidence to consume it, right? You can have cold pressed or virgin oils,
Hmm.
but refined oil is not supposed to be consumed by humans, right?
True.
It's a strong statement, but there is a lot of evidence supporting it. Refined oil came into existence in our diet in after 1980s. That is,
Hmm.
the first dietary guidelines were introduced in the world in 1980s, and they recommended the use of refined oil. What happened after the introduction of this into our diet was
Hmm.
that it gave birth to junk food industry,
Hmm.
because without refined oil you cannot sell a product, you cannot manufacture it
Hmm.
and pack it and sell it in a market, because the shelf life of any
Hmm.
food product cooked in ghee or
Hmm.
butter, it's not going to have a
Hmm.
good shelf life, so it does not become profitable. So refined oil
Correct.
increases that shelf life to 3 months, 6 months, 1 year, or even more, and that increases
Hmm.
the profitability of the food product. So the entire
Correct.
junk food industry is based on the use of refined oils.
Hmm.
And that is why one should not be having it on a regular basis. You can have it occasionally.
So, what oil do you recommend? I know it's not we can recommend any oil, but if not refined oil, what's the better substitute to that then?
Ghee is the best, right? One should cook everything in ghee or butter. These are the very good cooking mediums, or some of the virgin oils like olive oil, uh, cold pressed coconut oil, cold pressed palm oil. These are the oils which are going to be healthy. So keep varying your fats as a cooking medium. Don't keep it one, because our body needs a variety. So that's why there are few dishes that are going to be very tasty, and it will create a very nice flavor with ghee. Some of them with olive oil, some of them with coconut oil. So keep varying. So if you have a variety of recipes in your diet, that's how you can have a variety of healthy fats in your diet.
So now, like we know that how oil and refined oil is actually it's harmful to us. But then again, is there any genetic predisposition that it'll be harmful to few people more compared to all of them? It's not that every person will get affected equally.
In cholesterol, there is a genetic component. There are five different varieties of genetic diseases which leads to increased cholesterol levels, that is hypercholesteremia or hyperlipidemia. So if there is a genetic defect in that individual, then these patients will have are likely to have extremely high level of cholesterol in the blood, especially the LDL level. Because some of this hereditary component, I will go a little bit in the biochemistry. Every cell has a receptor which can take in the LDL. So there are certain genetic conditions where the LDL receptor is deficient. So what will happen? More and more LDL will keep circulating in the blood. But lot of people who are there who are taking of this hypercholesterolemia, familial hypercholesterolemia, if they are on a specific diet, especially the low carb diet, they have an extremely good lifespan. So those patients will not be, be having an increased risk of heart disease, but certain hypercholesteremia and hyperlipidemia that has a genetic basis do increase your risk of heart disease. So most of the time, hereditary is blamed, but when you see it's the dietary component which is followed from generation to generation in a family. So if they have the same dietary pattern, so if your parents are having high cholesterol levels,
Eating the
you
same
end up
way.
having the high
True,
cholesterol level
true.
because probably you are eating the same way as your parent.
Correct,
If you
correct.
change
And
that and
this is
see,
so true.
then you will
As
know
I
the
said, that I have
difference.
a strong family history of hypertension as well as diabetes from my mother's side. And I changed my lifestyle and diet. I don't eat I love what my mother cooks, but I don't eat that. I have a very different diet and lifestyle. And as of now, I do not have any diabetes or hypertension. I'm not on any kind of a medications. And this I try to tell so many people that like if your mother had diabetes and if you're having the diabetes, or if your father had hypertension and you having, that means you need to change your kitchen first. So what you're cooking, that you need to change. And genetics, and not to blame everything on hereditary and genetics here. But we are aware that the sedentary lifestyle is very much linked with hypercholesteremia. So, what kind of a diet, or what kind of a lifestyle that actually predisposes or probably is responsible for high cholesterol level in our life?
So when we use the word lifestyle, it has three components. One foremost important is nutrition, that is the food that we eat. Second is your activity level, right? No, there's no compulsion in joining the gym. There's no need, right? But you should be very active in your life, like doing your household work, whatever you can do yourself, you should do it. When you're at the office, climb the stairs rather than taking an elevator as far as possible. Walking long distances, park your vehicle when you're going for shopping a little further. People have a tendency to park as close to the shop as possible. So it's better to park as far as possible at a comfortable, safe position of your vehicle, and then walk down from there. And if you have to buy anything for your house, and if you have to walk few hundred meters, you should go for that walk. Play with your children, right? Play with your pet. Go for a walk with your pet. So these are all activities that you can incorporate or increase in your daily routine life. Third most important is sleep. Most of us don't know the importance of sleeping well. So the duration is not only important, but it's the quality of sleep. Minimum, what the textbook say is 7 to 8 hours of nice, healthy, good quality sleep. It's very difficult to define a good quality sleep in a podcast, but it has to be like you should feel very energetic in the morning. You should not feel dull in the morning. So you should not feel drowsy once you wake up in the morning. So that is one clinical indication. One should not feel tired. You should be like awake and start your routine activities. Making tea, moving around, making your bed. Right? So these are all indications. If you're feeling tired in the morning, if you're feeling very hungry in the morning, that means you're not slept well, and along with that, you have not been eating well during your dinner. Right? So if you don't consume enough fat, and protein in your dinner, you're not going to sleep well. That is not going to allow you. So that's why you need to fill up your tummy with fat and protein, especially in dinner, so that your satiety is maintained for few hours without your hunger hormones coming into picture. So most of the patients who are on high carb diet, which I think I'm from Gujarat, so most of the Gujaratis are on extremely high carb diet, especially the refined carbs. So many of them I see in my clinical practice with various other they present to me with various other complaints, but I see that the sleep is disturbed. That is one question I ask to each of my patients, whether they have come for acidity or whether they have come for constipation or they have come for obesity or diabetes or any other tummy issues. That is one thing I have observed, that more than 50% of the patients are not having a good quality sleep. They think that they are sleeping well, but it's not that good quality. So these are the three components of lifestyle: sleep, nutrition, and exercise. Exercise does not mean joining a gym, right? Certainly not. That's, and I would say, an artificial way of increasing your activity. You should incorporate activity in your routine life.
Correct. And small things that you said, that park your car little, not very close to the mall or not very close to your office. Take the stairs. Take your pet for a walk or go and play with your children. These are such a small things that anyone can incorporate in their lifestyle. And you may not have to go to gym. Of course, I go to gym because I enjoy going to gym. I
Yeah, you can go to the gym if you enjoy it, but see, most of us are busy in the current world scenario, and taking 1 hour, 1.5 hours out of your routine life and spending in gym, you add traveling time also to the gym. If you have a gym at home, it's a different thing altogether. But see, if you are traveling half an hour in big cities to go to a gym,
true.
then come back half an hour later. So you're spending 3-4 hours for exercising. So you're getting rid of 3-4 vital hours of quality time that you can get out of this, right? So you can spend that time with your family in other recreational activity and socializing.
Normally, is it advisable, and at what age we need to routinely screen to see whether our cholesterol is high, or get your lipid profile done, and what kind of a people need to make sure that they screen it at least once?
There are no specific guidelines when one should start measuring cholesterol, but most of us, when you start having problems, most of us start measuring their sugar by the age of 30. Suppose when you have gone for any medical problem to a doctor, they are going to get your sugar levels done. So if that is abnormal, you should as well get your lipid profile done that time, irrespective of age. But otherwise, once you're 40, you should get it measured once so that you know what is wrong.
So I have seen the lipid profile report. Okay, it has VLDL, LDL, HDL, multiple parameters it gives. Can you explain? Can you help me read that? How to read that report?
So there are few parameters in your lipid profile. One is total cholesterol, your HDL level, your LDL level, your VLDL level, and your triglyceride level. And the HDL cholesterol ratio is there. And there are other two reports which very few laboratories do, is ApoA lipoprotein and ApoB lipoprotein. If you want to simplify reading your lipid profile, the first and foremost thing that you should read in your lipid profile is triglyceride levels. If your triglyceride level is high, then you should be worried. If your triglyceride level is normal or low, then there is no need to worry. So then, if it is normal or within or it's low, then you second most important thing in your report is your HDL level. Your HDL level should be in either male or female should be more than 40-45. I've seen many patients even having 60, 65, 70, right? Especially those who are under my care and my treatment, once they have change their diet, the HDL naturally goes up, which was there around 35. Now it has been more than 60 plus. So HDL is the second most important parameter that you need to look at. If your HDL is low, then you're worried. You should be worried. If your HDL is high, then it's good. It's considered to be good cholesterol, but I don't label cholesterol as good or bad. Cholesterol is cholesterol. It's the lipoprotein which is good and bad, right? So LDL lipoprotein is bad, but the cholesterol inside the lipoprotein is going to be the same cholesterol that is there in HDL or that is there in VLDL. And the last and the least most important thing is ApoB. If your ApoB lipoprotein is high and your this apolipoprotein A is low, then you should be worried. Why? Because LDL has two subtypes, multiple subtypes, but broadly categorized into large LDL and small dense LDLs. So small dense LDLs are the one which causes heart disease. They cause the increase in risk in heart disease. LDL per se is not directly responsible for heart disease. It is the small dense. How do you know whether you have small dense? Two persons are there. If their cholesterol is 200, total cholesterol, but their LDL level in one person is 150, in another it is 100. So not necessarily the 150 guy is going to be a high risk. You have to check the ApoB lipoprotein. You have to check the triglyceride levels. If you see the increase in triglyceride and increase in LDL, then that person is at extremely high risk of heart disease. But if the ApoB is low and triglyceride is low, in spite of your LDL being high, so number of particles are important. Your LDL level 150, but if it contains 100, say 1000 particles, and your LDL 100 is containing 2000 particles, then that LDL 200 is going to be more at risk. LDL 100 is going to be more at risk rather than 150. You got the point? And very few doctors are actually aware of this. I have given talks at various forums, but it's news for them. But this is actual basic science of cholesterol that every doctor should be aware of.
Correct. So assume that I'm 44 and I do once in a year. I do my health checkup. I see that I do my lipid profile, and I see that the range is little different. Okay, it's bold in my report, and I am little worried because I have done the health checkup because there was a health checkup available in nearby diagnostic center. So at this point of time, if I visit you and I say that, sir, this is what happened, my my lipid profile is slightly deranged, and if I'm at the borderline, what's the first advice you give it to your patient? Where do they start if the report is not normal?
So I don't look at the lipid profile in isolation. I need to see the other reports along with it as well. Like I need to see the complete blood count of the patient, sugar status of the patient, so HbA1c. I need to know the fasting insulin levels of the patient, and I need to see the thyroid status of the patient. So I need to know the other metabolic parameters and micronutrient deficiency parameters. So never look at lipid profile in isolation. You have to, see all these reports together and then clinically see the patient. What are the complaints? Dietary knowledge of the patient is also very important. So what I mean by that is the dietary history of the patient, what he or she is eating throughout the day and how they have been eating for many years. So that is also very important. How frequently they cheat, what is the content of the junk food. Most of the patients of mine, they don't know what is junk food that they are eating, right? So khakra is one of the most common dietary component, especially in Gujarat, and
Yes,
khakra is
it
a
is
junk food.
healthy.
They don't know that this is junk food. Then yeah, और फिर वो आता है ममरा. Mamra, save, these are all not considered junk food by many of the
True.
patients. But these are junk food.
In your program, you were telling me, yesterday when we had a first call, that you get the complete investigation done. So we'll talk about your program a little later once we discuss more on cholesterol. But standalone report is not important, and I think your approach is you get the complete workup done, the blood work done, and that's not a very conventional practice in India, right? Like we don't do our blood work very religiously. So can you tell me a little more about that complete package that is there that you suggest your patients for, complete blood work?
I have a list of blood tests that I advise my patients to undergo, because my patients who come to me for a specific problem, when I inquire in detail, I end up finding a lot of other health related issues in those patients. So if you want to change, and many patients are concerned about their risk of heart disease, their risk of other diseases are also there, but the awareness is not there. So a detailed dietary inquiry is important. A detailed blood workup is important, one because our body systems don't work in isolation. One thing is connected to the other, chemically and biochemically. Right? So the impact of one nutrient deficiency is going to affect functioning of many organs in the body, many cells in the body, right? And that will be responsible for overall functioning of the body and metabolism. So we need to know, if I just treat the lipid profile, then the patient is not never going to be satisfied, right? Neither will I get the result that I intend to, but the overall patient outcome is not going to be proper, and it's not going to be optimal. So that's why I take the patient as a whole rather than one complaint. I need to ask a lot of questions to the patient, which probably they have forgotten to tell me. But when I inquire, so I have a list of questions. So it's a fill in the blanks for, it's a format, and then blood tests are being done, and then I evaluate both the things together, and then I advise whether the patient requires surgery for weight loss, or whether they can go for a medically supervised weight loss program, which is a 6-month program, and with a weekly visit in the first month, and then fortnightly visit every next 2-3 months. And then once I know that the patient has acquired enough knowledge, and patient is more has made a lot of change in their lifestyle, and they can get away with one visit a month, then I tell them that you just visit me once a month. But I leave it up to the patient. If they want to come weekly, I don't mind.
So with your program, which is of a 6 months duration, like where you are helping people to change their lifestyle, it's almost like a hand holding. You're teaching them what to eat, how to exercise, what all those things you are explaining,
Yeah.
and it takes 6 months time. So what's the success rate that you are able to see in your patient? How many require? Yeah.
So basically, the indications for this is somebody who's just want to be healthy, even though they don't have any complaints, right, or any disease. So these are the patients who can join the program. They just want to learn what is a good, healthy lifestyle. But very few, unfortunately, very few people come in this on in that stage. So usually come with some of the other chronic problems like obesity, diabetes, cholesterol abnormalities, uncontrolled hypertension, PCOS. These are the common indications with which they come to me, because now people know that my program works in all these conditions. So some of the doctors have started referring their patients. There are few doctors who are enrolled as my patients. Having said that, the success rate that you asked, weight loss, I give an minimum weight loss of around 10 to 15 kgs, and maximum that one of my many of my patients have achieved is 30-35 kgs.
Yeah.
right? And
Yes,
this
I
is
want
most
to.
of them without joining
Correct.
the gym.
I'm eagerly waiting for your program to
That
be
is more
published.
important. I don't advise anyone to go to the gym. So first month, no exercise is recommended when you are changing your nutrition. And then I tell them to
Hmm.
start exercising if they start feeling like it.
Hmm.
If they don't feel like it, they don't feel energetic from within, then no exercise. And when they start feeling energetic, no, I am now more active than before, then I share them few videos and few exercise tips that they can do at home or at workplace,
Hmm.
right? So it should be there in your routine life.
Hmm.
That's what I believe. I believe in simplification. So my nutritional advice is also simplified. My exercise advice is also simplification. No complicated exercises are required. You can buy few things for home, like an yoga mat, couple of dumbbells, a stick, then a ball, right?
Correct.
And that's it.
Yes.
You don't require anything else, and you can do most of the work, most of the exercise with every part of your body. Let it be upper limb, lower limb, your core, back.
Hmm.
Everything can be done by using these three, four things. And I've collected few videos from online sources.
Hmm.
I share the link with my patients. That's it. You just watch this videos and select which ones you want to incorporate initially. You don't need to do every bit of it, but start incorporating couple of them. Then once you are used to that, you incorporate another two.
Hmm.
So we need to take baby steps towards change. You can't make a drastic change. And that's the mistake that most people do, most healthcare providers do, right? Most dietitians, they make a see change in the
Yeah,
lifestyle
habits are
suddenly
difficult to break.
that nobody can incorporate immediately. So it has to be gradual without disturbing the routine life
Correct.
of the person.
One question here I want to ask the type of people, especially in India, where there are so many vegetarians out there, right? And our diet is very much carb heavy kind of a diet we have. Now, in these patients also, you think the
Yeah.
program is acceptable because I am non-vegetarian. I'm fine with my protein intake. So, how do you manage that with the vegetarian people?
So a vegetarian person can also make a change in their life. They need to be more disciplined with junk food, right? Their refined carb intake has to go down dramatically because they are already taking extremely high amount of refined carbs in their daily diet. So that needs to go down. So that's the one thing that they find it difficult. And you need to add protein and fat to that, because I don't believe in calorie counting at all or portion control at all, right? Because it's not me, but it's science.
Hmm.
The body does not should never be deprived of calories.
Hmm.
That's what the science says, and that's what I follow. So eating enough calories whenever your body is hungry, you should eat and satisfy your hunger each and every time that you are hungry. But
Hmm.
cut down your refined carbs and increase your fat and protein. I don't take pure vegetarians or vegans in my program because every patient that pays me asks for guarantee, and which I'm not sure
Hmm.
whether they will get benefit out of it or not. But if a person is eating eggs or non-vegetarian, then I can certainly guarantee them
Hmm.
that yes, you are going to get rid of these problems, right,
Correct.
in 3 months or 6 months, but you will definitely get rid of. And most of my patients do get rid of their problems. So weight is number one, diabetes reversal is another. And I've seen a lot of my patients with multiple drugs and then insulin, along with that insulin also, when they come to me with say 15, 20 years of diabetes duration. And when they follow this lifestyle, I've seen them cut down on their insulin in few days only.
Hmm.
So they are off insulin in 1 week to 10 days. And then they gradually I titrate the doses of their diabetic medications, and finally most of them end up having metformin,
Yes.
which is pretty safe drug. So I take that as a huge benefit for the patient. So you're getting rid of multiple medications, insulin, which is the most damaging.
People, those who try to do lifestyle changes, but still they are not able to get the beneficial results. So then, in what patients you suggest them any kind of intervention, whether these are the medical interventions or the surgical intervention?
So right now, there is an increase in number of patients undergoing bariatric and metabolic surgery. There are fixed criteria for that, which has been put down by the government of India and Insurance Regulatory Development Authority of India, IRDA. So any BMI more than 35 to 40 with diabetes or uncontrolled hypertension or osteoarthritis of knee or uncontrolled or severe sleep apnea syndrome. So these are the patients who can undergo surgery. They will benefit out of it. Then the other criteria is BMI more than 40 without any comorbid conditions. Then also they are recommended for surgery. But in those patients, it will be bariatric surgery, not metabolic. If you have diabetes, if you have hypertension, then it is going to be metabolic surgery because it controls diabetes also. It can get rid of your diabetes also.
Sure. What about the medications? We see that people with very slight derangement in the lipid profile, they are on medications nowadays, and even women or men. And we talk about perimenopausal, postmenopausal women. So, do you recommend them to directly start the medications, or they should try for the lifestyle changes first? What's your opinion on that?
So, my first question to all these patients who have a deranged lipid profile is to ask their doctor, why my cholesterol profile, lipid profile is deranged? And I think I can tell you that most of the doctors will not be able to answer that question correctly because none of them have time to even think or inquire in detail about the patient's history or patient's dietary history because it's mainly connected to that. Second, I would tell all the patients that they should always first find out a way to naturally reduce your cholesterol. And it is possible in 100% of the patients.
Correct.
It is absolutely possible. You just have to change your eating. That's it. It is as simple as that. And statins, I have a very strong opinion for statins. I would not recommend that to be used at all in any of the patient, irrespective of a person already suffering from heart disease or not, because it's an extremely pharma oriented promoted molecule. First of all, you don't need to reduce your cholesterol, you just need to correct your cholesterol if the profile is abnormal. So your triglyceride is high, get your triglycerides down, then forget about everything else. If you can eat your diet which controls your triglyceride, then it will take care of the rest of the cholesterol profile. So it is as simple as that. So first cut down your refined carbs for 2 months and do it sincerely and judiciously, and then you measure your cholesterol again, and then you see the difference. If you see even 25-30% down or even 20% down, then believe that what you are doing is right and continue to do that. Your cholesterol will go on going down. You don't need medication. And medication has tremendous amount of side effects which are underreported, never discussed to the patient. None of the patients who come to me with statin, they are already on statin. I ask them, do you know what are the side effects of these drugs? They are not aware. 20% of the patients who take it for more than 5 years, they will suffer from type 2 diabetes. Right? So they develop a new onset type 2 diabetes. 10 to 15% of patients will either develop permanent or temporary neurological or muscular damage. There are studies now which have come up. Of course, they are not foolproof study, but that's an early indication. It still needs to be confirmed by various other studies that it causes neurological degeneration earlier. So Alzheimer's onset is preponed. Senile dementia, which is also quite common in old age, so that is also preponed.
Mm-hmm.
I would say even psychiatric conditions of which have increased.
Mm-hmm.
I would label it to statin as one of the factors. There are multiple factors, but it is one of the contributing factors. So statin, if it is up to me, I would just stop statin in every patient. I will never take it, even if the doctor scares me, even if I suffer a heart attack, even if the doctor says if you don't take this, you will die. I would say I don't mind because I know the science that it does not work and it is not required by the body. And no need to reduce your cholesterol. Actually, there are graphs on WHO website. Higher the cholesterol, lower the mortality, and better the quality of life at the end of your life. It's especially true for women. Women need to have higher cholesterol after the age of 50, but not triglycerides, but cholesterol, LDL. So higher the cholesterol, better the woman's health would be when they age. These are all facts. It's not what I have come up with. This is there on the WHO website. They have a graph from almost 100 countries. And it's a combined graph which shows higher the cholesterol, lower the mortality, and longer the lifespan. So this is fact. And why, I don't know why the mainstream organizations are ignoring this very important finding by WHO.
True, sir. But we do know that there are complications of high, lipid or high cholesterol in the body. What are those, and what are the most common complications that you have seen in your patients?
High lipids, I would say if the patient is having high triglycerides, then they have high risk of heart disease, high risk of diabetes, high risk of type 2 diabetes, and high risk of being obese, and everything else connected to that. So these are the main three worrisome: obesity, heart disease, and diabetes. So if you have high triglycerides, you are either of the three or all the three will you are at risk of either of the three or all the three. So some patients will end up having heart disease first. Some patients will end up having type 2 diabetes first.
I wanted to discuss little more before we close about the cholesterol, little more about your program. I really want more and more people to join the program just to be healthy, because I know that there are so many random websites that they are promoting healthy lifestyle programs that are there. Either they go with like a very strict kind of a diet, there are fat diets that are there, and it's not practical. Like, I have gone through so many stages of trying out things and changing my diet style, lifestyle, and diet and everything, and I know that it's not sustainable. More people should go for evidence based, a very organized kind of a lifestyle change program. 4 to 6 months is good enough, and in that you are educating them how to change your life. For what kind of a patients do you suggest this program?
So anyone who is concerned about weight, anyone who is concerned about PCOS, especially women basically, type 2 diabetes, uncontrolled type 2 diabetes, generally they want to be healthy. Uncontrolled or untreated, untreatable acne, these are the patients who come to me and I have seen they get rid of their acne permanently. I have few photographs that I have of my patients before and after. They came with very bad acne and now it's absolutely gone. It's a clean slate. So that is another thing. Then patients who are having bad acidity, constipation, IBS, these are the patients who should change their diet. So just eat healthy what the humans are supposed to eat, and you can get rid of your acidity permanently. You can get rid of your constipation permanently. You can get rid of your IBS symptoms. right? Because IBS is a condition where there is an irregularity in motions, creates lot of psychological issues to the patient. So if you treat this, the patient becomes all right, and then he's able to focus on the rest of his life. And I tell you, I was suffering from IBS. I had a very bad tummy for the last many years. Then 7, 8 years back, I changed my diet. It's completely gone now. Within probably 3 months, I see a change. My cholesterol went down dramatically from 280 to less than 200. My triglycerides from 550 it went down to less than 200. I reduced my weight, of course. Weight loss is a side effect of this lifestyle. So it's not a target. So when a patient comes to me, they come for weight most of the time. But I tell them that you have to become healthy first. Weight loss will happen on its own. Only a healthy body can lose weight sustainably. While most of the practitioners they target weight to become healthy. I actually follow the reverse pattern, that is become healthy first by eating the right food, correcting your nutrient deficiencies. And when the body becomes healthy, weight loss automatically happens. It's a side effect. You don't have to go after weight. Today only I had one patient who had undergone surgery by me almost 8, 9 years back. She regained weight. So I got a CT scan done to see the size of stomach. It was not that big. Hardly 25% increase in the stomach size that was supposed to be there. And I put her on this diet. It's just 3 weeks. She came to me today and she lost 4 kgs in 3 weeks. And that lady cannot walk much. That lady cannot, certainly can't do any exercise. She's 115 kg, a 65-year-old female. So she certainly cannot go and do any form of exercise. She has a bad knee, can't recommend even walking. She's almost sedentary, you can say. She's active at her home, doing all routine activities. But this is what happens when you start eating the right food. So 4 kgs in 3 weeks. So it's not the quantity. The importance is patient was eating nicely, was happier than before, losing weight. So weight loss gives a definite motivation that yes, it is working. But many of my patients don't lose weight initially, but gain weight. But I tell those patients beforehand, because any patient who comes to me with under eating, and if I put them on my lifestyle program, I want them to eat well. So they will gain 1 or 2 kgs. But I want them, I tell them, that you are going to gain because now you are going to eat food. So once you gain weight, that is a healthy thing to do. Then you will start losing. But the gain weight is only 1 or 2 kgs, not more. It's a good sign. I want their metabolism to basal metabolic rate to go up. But before that, she has to start eating well. So before the metabolic rate goes up, she will gain weight. But when the you're good eating, your metabolic rate also goes up. That's when you start to reduce your weight,
My
lose
last
fat, basically.
question regarding the program, as well as what we have discussed, is regarding the supplements. There are so many supplements that are available online. People keep adding into their diet. So, one thing is, in your program, are there any supplements that you recommend? Second, what are the supplements that you must add in your lifestyle?
So I definitely would advise supplements because most of us are deficient. There is no Indian diet which will give you each and every nutrient, micronutrient. Macronutrient you can fulfill, but macronutrient deficiency is going to be there for one or the other thing. So it's better if you are suffering from any chronic diseases like diabetes, obesity, heart disease, you have to consume some micronutrient because there are no tests for each and every micronutrient deficiency. There are tests for certain micronutrient deficiency like B12, D3,
Hmm.
folic acid, iron. These are the common tests that are being done. So if you find there is a sudden increase in B12 and D3 deficiency in our country, and iron was already there. So iron replacement is very important for
Hmm.
those who are iron deficient. Otherwise, they are not going to lose weight. B12 folic acid, D3. So, any good multivitamin which contains most of this will be enough as a therapeutic dose, basically. And along with that, vitamin D3 has to be given separately. Iron has to be given separately because none of the multivitamins will contain enough iron. And B12 folic acid also for short period of time needs to be taken separately. Then I advise them on L-carnitine supplements for a couple of months. And there is another supplement which I want them to take for 1 or 2 months is coenzyme Q, which should be part of multivitamin. If it is there, then you don't need to take it separately. But if it is not there, then coenzyme Q is very important. That is very important for energy production. So it affects the metabolism at micro molecular level. Just as a blanket therapy is given for few months, and those who are protein deficient, I give a special low carb protein powder for a couple of months till they satisfy their protein needs from the diet. If they start eating a good healthy diet on a regular basis, then you can cut down your protein powder. Initially, I would recommend that everyone should take just to correct your deficiency, change your hormones,
Got it.
basically. That
Okay,
helps.
that's I'm really happy that these are the simple supplements and they are not at all expensive. Biggest problem with the supplements and that are available online, they are like so
Yeah.
very expensive. Even if we talk about multivitamin, you get it at 150, 200 rupees, or even Supradin kind of other vitamin that we prescribe in our medical practice are very, very low cost. But there are multivitamin that are like 4,000 rupees, 30, 60 tablet kind of a thing. That's quite a expensive. Even I feel that, okay, how I'm supposed to buy these supplements.
Good multivitamin will cost anywhere from 10 to 15 rupees a tablet. 150 rupees
Yes,
for strip,
definitely. And
which
whatever
is,
the
I think,
supplements you are
fairly
talking about, they are
affordable.
very much affordable, not like very high-end supplements that are.
Yeah, yeah.
Yes.
Iron, folic acid, and B12, they are very cheap. There are companies who are
Correct.
manufacturing at
These
25
are
rupees a
very
strip or
safe kind
30
of
rupees a strip.
supplements as well. We have absolutely proven evidence. Great. So when
Yeah.
your program will be online, and you are from Vadodara, so only the Vadodara people are going to get benefited, or people like me in
Yeah.
Pune, Bangalore.
Yeah, right now I have offline program only, so which I have been running since 2017. But yes, online program because it's quite complicated. I cannot have a software to automate every bit of things because this requires a lot of personal coaching. So I cannot get myself out of the advice because that's what will make a difference. So this kind of one-to-one, face-to-face talk and consultation is extremely important because this program is 90% is counseling, explaining every bit of small information why you need to do this. How will this make a difference in your
True.
body? So I
So
cannot have
even
all
I
this
think
information online.
if I am there in Pune,
So
if
it's
I miss a
difficult
couple of
to.
visits in Vadodara, but remotely I can still do the online consultation and we can finish the program.
Yeah. So I am trying to build up a online platform in the near future. It's the website is under construction only because I want to have this program. I want to teach nutrition also for a common man. There will be program for common man. There will be program for dietitians and nutritionists. There will be program for clinicians to know basic knowledge about nutrition. So there will be a very simple course and a very complex course for people who are into nutrition, right? And simple courses for general public. Basic awareness, basic misconceptions need to go because there are a lot of myths and why they have been followed and what are the results because of that,
Very true.
which needs to be told to the patient. There's something called I can tell you what your doctor doesn't know. a doctor has not told you.
What your doctor is
Right?
not
So it
telling
can
you.
be a talk on that only. Because probably they are not aware of
And
it.
we do
Not
accept.
every doctor is aware of everything. So I won't be aware of so many things. But at least I am aware of this. So I want to share that. So like other doctors with some other specialty will share their expertise on to the patient. If a joint surgeon is there, I won't be knowing everything about joint.
Correct. They have the
I need to
expertise.
have information from people who know about it. So similarly, this is my forte, and I would say I am not a master, but I know
And
enough
patients are getting benefited.
to make a change.
This I personally feel that no doctor will deny the fact.
Exactly.
We know that lifestyle changes are important. You have given the structure to that, and you have implemented with your patients, and you see the results, and you know that
Yes.
it works, and that's actually the definition of the science. And now you want to more and more people to benefit it.
So the best way to know whether this works is try it on yourself for 3 months. You have to do it for 3 months, honestly and sincerely for 3 months, and then make a decision whether whatever I'm saying or I'm practicing is
True.
good for you or not.
Very.
But you have to do it for 3 months. Then only you can be honest to yourself
Yes. So
and take a judgment whether it
so
is
wish you
good or
luck,
not.
and I really want the moment it will be available online across India, people should be benefited, and they should be able to contact you. We'll
Yeah.
do effort. We'll put our efforts to make sure that this through this
Thank
video,
you. Thank
people will get to know that your program is available and how to do lifestyle changes. Whether you're vegetarian or you're
Right.
not vegetarian, anyone can do that. And
So I will share my lifestyle program with you, the details.
okay.
Go through it, try it on yourself
Oh,
first,
that's the best one. Okay.
and then
So
share it to
I'll
the
start
general
your
people.
program now. So
I'll explain once I share that with you. We'll have one
I'll do
session
that.
like this
And then I'll
again,
give
and
my
I will
review
tell
as
you
well.
how to do it. Then you can even
Yes, that'll.
share your videos and
I really
reviews
want to
with
do it.
everyone
I'll
else.
get my investigations done, and I'll get in touch with you how to start the program. Okay.
Sure, sure. I'll share the investigation list also.
Okay.
I will share my one-page
I
dietary
have
advice
lots of
also.
benefits.
So yeah, I give it to all my patients actually who come to my clinic, irrespective of whether they're coming for weight or not. I give this dietary advice to my acidity patients, my constipation patients, patients with general uh, vague complaints coming to me. So today I had one patient with absolutely vague complaints that once after meals my brain starts to vibrate. Right? A young girl working in a multinational company at a good position, 35-year-old female, and she started speaking about complaints which are irrelevant. There's a complete disconnect between the complaints. Normally, one complaint follows the other. There is some connection between the complaints. In her case, absolute disconnection. Then I inquired about her dietary history, and that is where the cause was there. She was extremely undereating. I could see from her appearance. She was underweight. She was malnourished. She was nutritionally deficient. So first thing I told her, you have to eat well for next 15 days. Give you some medications, some supplements. But next 15 days, you just eat well. Eat well with my dietary advice. And come back to me after 15 days. I want to see even 10% change that you feel. And you should feel happy about it. And if that 10% change is a remarkable change that you need to appreciate. And once you do that, then continue the same thing. You should not require any medication for anything. And she had come with a bunch of files. I said, you're the only deficiency that you have is food. So you eat well. This is the list of foods that you eat. This is the list of foods you don't eat. And figure out whatever recipes you want to create out of the foods which you need to eat. Recipe is up to you. And that's what you're supposed to do. So food deficiency is also a big issue in young females. They don't eat well. And that is why PCOS is there in one in every third female.
Yes, I have observed there are people, those who are working in my office, girls, those who are working. couple of them talked about PCOS and they do not have obesity, but they still have PCOS and they are doing lifestyle changes. They are visiting their gynecologist. So I've seen that it is not always that obesity will be there for PCOS. Thank you so much. Thank you so much for taking out time and explaining. We started with cholesterol. I think another topic that I want to discuss with you is a fatty liver. I think that's very, very interesting, and very few doctors as well as patients they understand that. And I'm looking forward to discuss with you about it. And I'm looking forward to be your I won't call a patient, but your follower to follow your protocol.
Yeah.
Yes, I'll be your follower.
Yeah, that's a better word.
I don't want to. I think
You
that's
you don't look like a
for
patient.
life. Great. Thank you so much for your
Yeah.
time.